Okay, Kerry, you've read Barry's notes. Can you tell me what you found out about him?
Yep. Okay, so Barry's 68 years old. I think it was about 2 or 3 months ago he had a left intracerebral hemorrhage or a stroke, and since then he has been in and out of hospital, some different locations. He has a past medical history of, I think he has hepatitis C that was required through a transfusion in the 70s.
Yep.
I think he had some surgery possibly for bowel cancer.
Yep.
From memory. Barry lives with his wife. He has 6 supportive children,
Yep.
3 of which live locally to him. I think they're down on the peninsula.
Yep.
And he is a retired plumber, I think it was, or
Yep, that's right.
working in things like that. Yeah, and I did read through some of the notes that he had there and some of his goals, but I'm not sure if we're meant to discuss that at this point.
Yeah, I think if you read what his goals were in the notes, you can tell me what they are.
Okay, so, yep.
But it wouldn't hurt to ask him again.
Okay, sure, yep. So,
Yeah, tell me.
Yep, so the goals were that he'd like to walk independently with a single point stick.
Yep.
And also I think he wanted to have more function in his right hand.
Yep.
To be able to use the computer and that kind of thing. I think they were some of the main goals at this stage.
Okay, so some of the things you've mentioned already, Kerry, suggest that he's got some hemiplegia. Was there anything else that you noticed from the notes that might be significant in relation to the assessment you want to do and maybe his outcomes?
I did read there was, I didn't look in detail, but he had some communication deficit. So
Yes,
I think
that's right. Yep.
some word finding problems.
Yep.
That he's had.
Yep, that's right.
Yep.
And what about cognitive problems? Was there anything that you noticed from the notes?
I didn't notice anything from the notes.
Okay, so
I think actually no, I did read something about decreased short-term memory.
Yeah, that's right. So he's got a pretty good mini mental, 9 out of 10.
Yep.
But he possibly has some decreased speed of processing and some cognitive overload. So we have to be a bit careful we don't overwhelm him with too much at once.
Yep.
Having said that, that was a number of weeks ago that assessment was made, so it might not be the case anymore. Okay, great.